All right, welcome everyone to the deep dive.
Right.
Today we're going to be tackling something super important, something you really need to know about for your health, and that's hepatitis C.
It is.
It's a disease of the liver, and it's caused by a virus. You probably heard of it. It's the hepatitis C virus, or HCV.
Yeah.
And what we're going to do in this deep dive is kind of give you the shortcut to understanding what this virus is all about,
Yeah.
how it spreads, and what you can actually do about it.
Yeah.
And we're not just, talking out of thin air here. We've got information from a lot of top sources like the Centers for Disease Control or the CDC, the American Liver Foundation, Mayo Clinic, and even more, just to make sure we're giving you the best, most accurate information out there.
Exactly. We want this deep dive to be like your go-to resource for understanding hepatitis C.
Yeah.
We're going to clear up all the confusion and give you the essential information you need to know about this condition.
All right, so let's get into it.
Absolutely.
What is hepatitis C? What is it doing in the body?
Okay, so hepatitis C is basically an inflammation of your liver, and it's caused by this hepatitis C virus. Now, your liver is amazing.
Yeah.
It's like this huge processing plant inside of you. It's your biggest internal organ, and it does so much. It filters your blood, gets rid of all the bad stuff, helps your blood clot, stores energy, and produces bile, which helps you digest fats. It's essential for keeping you healthy.
I mean, that's a lot of jobs for one organ.
It is. It's a powerhouse.
All right.
And the hepatitis C virus, it specifically goes after those liver cells.
Okay.
Particularly these little units called hepatic lobules. You can almost think of it like the liver's a busy city, and these lobules are like the individual factories doing all the work.
Oh, I like that analogy.
Yeah, so the HCV, it sneaks into these factories and messes things up.
Starts causing some trouble.
Exactly.
Yeah.
Now, one of the first things to understand about hepatitis C is that there are two main types: acute and chronic.
Okay.
Acute hepatitis C is what happens in the first 6 months after you get the virus. It can be a short-term illness, and sometimes your body's actually strong enough to fight it off on its own.
Oh.
But, and this is important, for most people, sadly, acute hepatitis C turns into a chronic infection, which means it sticks around for the long haul.
So chronic is the one that's like the ongoing issue, like the more serious one.
Yeah, chronic hepatitis C is like a long-term relationship you don't want. If it's not treated, it's a lifelong infection, and it affects over half the people who initially get infected.
Wow.
And if it's left to do its thing, it can cause some serious damage. Liver damage, cirrhosis, which is where your liver tissue gets all scarred and can't do its job properly, liver cancer, liver failure, and even death.
Yeah, that definitely makes it clear why understanding this and dealing with it is so important.
It really is.
Now, you mentioned different types of the virus. Can you explain a little more about what that means and why it matters?
Sure. So hepatitis C actually comes in different versions, kind of like different models of a car, and we call these genotypes.
Phenotype.
Yeah. Scientists have figured out that there are 7 main genotypes and a whole bunch of subtypes, and each genotype is a little different in how it behaves. In the US, the most common ones we see are genotypes 1A, 1B, 2, and 3.
Okay.
Here's the thing. Having one type of hepatitis C doesn't mean you can't get infected with another type.
Oh, okay.
Kind of like how getting the flu one year doesn't mean you're immune to all the other flu strains that are going around.
So you could potentially get it multiple times.
It's possible, but it's less common. The point is, this variety in the virus makes treatment a little more complicated, but luckily we have treatments now that work against many genotypes, which is a huge step forward.
Oh, that's great to hear. So how does this virus actually move from person to person? What are the main ways people get exposed to it?
Hepatitis C is mainly spread through contact with infected blood or body fluids that contain blood. It's what we call a blood-borne virus.
Bloodborne, okay. So what are the most common ways that kind of contact happens?
Well, right now in the U.S., the most common way it spreads is through sharing needles or syringes or any equipment that's used for injecting drugs.
Right.
That's a huge factor in new HCV infections.
That makes sense.
Another way is from a mother with HCV to her baby during birth. That happens too, although thankfully the risk is relatively low, only around 6%.
Okay, so those are the most direct routes where there's obvious blood involved.
Yeah.
But are there other less common ways that it can be spread?
Yeah, there are a few other scenarios.
Okay.
Sexual contact with someone who has HCV is possible, but the risk is generally low, except for men who have HIV and also have sex with men.
Right.
Sharing personal items that could have infected blood on them, like razors, toothbrushes, nail clippers, even blood sugar monitors, can also transmit the virus,
Oh, wow.
although that's less common.
Okay.
Direct contact with an infected person's blood or body fluids, like if a healthcare worker gets stuck with a needle, is another way. Then you have tattoos and piercings. If you get those in places that aren't properly regulated and don't use sterile equipment, that can be a risk too.
Yeah, that makes sense. What about things like blood transfusions? I remember hearing that used to be a risk.
You're right, that's a good point. Before July 1992, blood transfusions and organ transplants did carry a risk of HCV transmission, but that's very rare now because all donated blood and organs are thoroughly screened.
That's good to hear.
So it's really about being careful with blood-to-blood contact.
Okay, so it's blood-to-blood contact. That's the main concern. What about just being around someone with hepatitis C in everyday life? Like, can you catch it from casual contact?
This is where it's really important to understand that hepatitis C is not spread through casual contact.
Okay.
You can't get it from sharing utensils, hugging, kissing, coughing, sneezing, or anything like that. It's not transmitted through food, water, or breastfeeding either.
So those everyday interactions with someone who has hepatitis C are totally fine.
Exactly. It's about knowing where the real risks are and not creating unnecessary fear or stigma.
Right, right. Now, who are the people who are at a higher risk of getting hepatitis C?
There are a few groups of people who have a higher chance of being exposed to the virus. Anyone who currently injects drugs or has in the past is at higher risk.
Okay.
People living with HIV are also at increased risk.
Mhm.
And certain medical situations can also increase the risk, like if someone's been on dialysis for kidney failure, or if they consistently have abnormal liver enzymes in their blood tests.
What about the blood transfusions and transplants we just talked about?
Yes, anyone who received blood transfusions or organ transplants before July 1992, when they started screening for HCV, are at higher risk.
Yeah.
And people who use clotting factor concentrates before 1987, which was used to treat conditions like hemophilia, are also in that group.
Got it.
Healthcare workers and public safety personnel who might have been exposed to HCV-positive blood, like through a needle stick, are also at higher risk. Babies born to mothers with hepatitis C, people with hemophilia treated with those older clotting factors, and sexual partners of people with hepatitis C are also considered higher risk.
It seems like there are a lot of different circumstances that can increase someone's risk. Any other notable groups we should be aware of?
Yeah, a few more. Men who have sex with men, particularly if they're also HIV positive, people who have a history of other sexually transmitted infections.
Okay.
And a big one, people born between 1945 and 1965, the baby boomers, they have a higher risk too. And lastly, people who have spent time in prison also have an elevated risk of HCV infection.
So a pretty wide range of people and situations, it seems. Now let's move on to the symptoms. If someone has hepatitis C, what are they likely to notice? What are the typical symptoms?
This is where hepatitis C can be tricky. A lot of people, both with new infections and long-term ones, have very mild symptoms or no symptoms at all, and they might not even know they're infected.
Oh, wow. So they could have it and not feel sick at all.
It happens all the time. This silent phase can go on for years, even decades.
That doesn't sound good.
No, it's not ideal because it means the virus can be damaging your liver without you even realizing it. That's why it's so important to get tested, especially if you have any risk factors.
Okay, so it's possible to have it for a long time without feeling unwell. But what about when there are symptoms? What do those look like, especially in the early stages?
Well, if symptoms do pop up in the acute phase, which is usually within 2 to 12 weeks after exposure, but it can be as long as 26 weeks, they're often pretty mild and easy to mistake for something else.
Like what?
Jaundice. That's where your skin and the whites of your eyes turn yellowish.
Right.
Fatigue, just feeling really tired. Nausea, fever, and muscle aches.
Those are all pretty common symptoms for lots of things.
Exactly. That's what makes it so tricky. Now, if the infection becomes chronic and starts causing more liver damage, the symptoms can become more noticeable and serious.
Okay, what are some of those signs?
Well, you might start bleeding or bruising more easily than usual. You might feel constantly exhausted, lose your appetite, experience jaundice again, have dark urine, itchy skin, fluid buildup in your belly, which is called ascites, swelling in your legs, unexplained weight loss.
Oh, wow.
And in more advanced cases, you might have confusion, drowsiness, slurred speech, which is a sign that the liver is really struggling. You might also see these tiny spider-like blood vessels on your skin called spider angiomas.
Those sound like some pretty serious red flags.
They are. It means it's time to see a doctor right away.
For sure. So given that so many people don't have early warning signs, how do you actually find out if you have hepatitis C? What's the testing process like?
Testing is the only way to know for sure if you have HCV. Because it's often asymptomatic, routine testing is crucial, especially for those at higher risk. It's like checking the engine light in your car. You might not notice a problem while you're driving, but the light can alert you to something that needs attention before it becomes a major issue.
I like that analogy. So who should be thinking about getting tested for hepatitis C?
Well, the CDC recommends one-time hepatitis C testing for all adults 18 and older and for all pregnant people during each pregnancy.
Okay.
Regular testing is recommended for people with ongoing risk factors, like those who inject drugs.
So what kinds of tests are out there to check for hepatitis C?
There are two main types of blood tests. The first is the HCV antibody test. This test looks to see if your body has ever been exposed to hepatitis C and has produced antibodies to fight it.
Antibodies, right.
This test can be done in a lab, as a rapid test in a doctor's office, or even with a home test kit.
Oh, wow, at home.
It's pretty convenient.
So if the antibody test comes back positive, does that mean you definitely have hepatitis C?
Not necessarily. A positive antibody test just means your body has encountered the virus at some point, but it doesn't tell us if the virus is still active. Your body might have cleared it on its own, or you might have been successfully treated in the past. The antibodies can stay in your blood even if the virus is gone.
Oh, so it doesn't necessarily mean you're currently infected.
Right. That's why we have the second test, the RNA test, which is also called a NAT test. This one actually looks for the genetic material of the virus in your blood.
So it tells you if the virus is still there and active?
Exactly. If your antibody test is positive, they usually do the RNA test automatically to see if you have a current infection. If someone thinks they were exposed very recently, like in the past 6 months, their doctor might order an RNA test right away because it can sometimes pick up the virus earlier than the antibody test.
I see. And how do you interpret the results of both tests together?
Well, a negative antibody test usually means you haven't been infected with hepatitis C unless you were exposed very recently and your body hasn't had time to make antibodies yet. A positive antibody test followed by a negative RNA test means you were infected in the past, but your body got rid of the virus, either on its own or with treatment. And finally, a positive antibody test and a positive RNA test means you have a current hepatitis C infection.
That makes sense. It's a two-step process to get the full picture.
Yeah.
Now, if someone does test positive for current hepatitis C, what are the treatment options these days?
This is the good news. The goal of hepatitis C treatment is now a cure.
A cure, that's great.
We define a cure as achieving what's called a sustained virologic response, or SVR. It means that the test for the virus in your blood, the HCV viral load, stays negative for at least 12 weeks after you finish treatment.
And is a cure actually a realistic outcome now?
Absolutely. Cure rates are really high now, often over 95%, thanks to these new medications called direct-acting antiviral drugs, or DAAs.
DAs, okay.
It's amazing, really. Just a few decades ago, hepatitis C was basically a life sentence of potential liver failure. Now, with these new drugs, it's often just a matter of taking pills for a few weeks, and the virus is gone from your body. It's a huge change in how we approach this disease.
Wow, that is a huge change. So how do these DAs work? What do they actually do?
These medications target specific parts of the hepatitis C virus and block its ability to replicate or make copies of itself. Treatment usually involves taking these medications by mouth, just pills, for a short period, usually 8 to 12 weeks. And the benefits of successful treatment are huge. It reduces inflammation and scarring in your liver, improves complications like high blood pressure in the liver, and most importantly, it really lowers the risk of long-term liver damage, liver cancer, and death.
And are there different types of these antiviral medications?
Yeah, there are a few different ones, and what's really exciting is that we now have pan-genotypic treatment options. These medications are effective against all the different genotypes of HCV, so we don't always need to know exactly which genotype someone has before starting treatment.
Not that convenient.
Examples of these are combinations of drugs like sofosbuvir and velpatasvir, or glucuravir and pibrentasvir. It's like having a universal key that works on all the different locks.
Nice. You don't have to find the exact right key for each lock anymore.
Exactly. So what factors do doctors consider when deciding on the best treatment plan for someone?
Yeah, what goes into that decision?
Well, they look at the amount of virus in your blood, what we call the viral load. They might consider the genotype if they did that test. The extent of any liver damage, especially if there's cirrhosis, which is scarring of the liver. any other health conditions you have, and whether you've had any treatments for hepatitis C before.
You mentioned cirrhosis again. How do doctors figure out if someone has that level of liver damage?
Before starting treatment, it's crucial to assess the amount of fibrosis or scarring in the liver to see if it's progressed to cirrhosis. This helps determine how urgent treatment is and might influence the choice of medications. There are both invasive and non-invasive tests for this. A liver biopsy, where they take a tiny sample of liver tissue, is an invasive method. But we also have non-invasive tests, which include special blood tests and imaging techniques.
So they can get a good idea without always doing a biopsy.
Exactly. Now, I know you might be wondering about a vaccine for hepatitis C.
Yeah, is there one?
Unfortunately, no, there's no effective vaccine available yet.
Oh, that's too bad.
The main reason is that the hepatitis C virus is very good at mutating, which means it changes its genetic makeup all the time. This makes it hard to develop a vaccine that can provide lasting protection against all those different versions of the virus. But researchers are working hard on it.
I hope they come up with one soon.
Me too. One last thing about treatment. It's really important to stick to the prescribed treatment plan and take all the medications exactly as your doctor tells you to.
Why is that so crucial?
Because these treatments are usually pretty short, taking every dose as directed gives the medications the best chance to completely wipe out the virus. If you miss doses or stop early, it can make the treatment less effective and could lead to treatment failure.
So even though there's no vaccine, the really encouraging thing is that if someone does get hepatitis C, it's usually curable now. Let's talk about prevention. How can people protect themselves from getting hepatitis C in the first place?
Since we don't have a vaccine yet, the best way to prevent hepatitis C is by avoiding the things that spread the virus.
Okay, what are the key things people should be doing to stay safe?
The absolute most important thing is to never share needles or any equipment used to inject drugs. That's the biggest risk factor. Practicing safer sex by consistently using condoms can also reduce the risk of transmission, although, as we said, sexual transmission is generally less common than through blood. If you're thinking about getting a tattoo or piercing, it's essential to go to a place that's licensed and reputable and that uses sterile, single-use equipment. Avoid sharing any personal hygiene items that could have blood on them, like razors, toothbrushes, nail clippers. And in healthcare settings, it's important for healthcare workers to follow those strict precautions to prevent the spread of infections.
What about when people are traveling to other parts of the world? Any specific advice for them?
Yes. When you're traveling, especially to areas where hepatitis C might be more common or where healthcare standards are different, be careful about unscreened blood transfusions. If you need any medical or dental procedures, make sure the clinic is reputable and that they use sterile needles. This also goes for tattoos and piercings. And as always, practice safe sex.
Okay, so those are all really important steps to minimize the risk. Now, what happens if someone is diagnosed with hepatitis C? What's it like living with it? And what happens after treatment, especially if they're cured?
Being diagnosed with hepatitis C can bring up a lot of emotions, so having support from friends and family or support groups can be really helpful.
Of course.
Even after being cured, which is amazing, it's important to remember that reinfection is possible if someone continues to engage in high-risk behaviors, like injecting drugs. If that's the case, regular RNA testing is a good idea.
What about the long-term health of the liver after someone's cured?
People who had cirrhosis, that severe scarring of the liver before being cured, need ongoing monitoring. This usually includes regular liver cancer screening, which might involve an ultrasound and a blood test. It's also a good idea to avoid drinking too much alcohol to protect your liver in the long run. And it's best to let all your healthcare providers know about your past hepatitis C infection, just so they have all the information.
Okay, so even after a cure, there might still be things to be mindful of.
Right.
Well, this has been a really in-depth look at hepatitis C.
It has.
To wrap up, what are the key takeaways you want our listeners to remember?
Okay, here are the essentials. Hepatitis C is serious and can harm your liver without you even knowing, but the great news is that it's now highly curable for most people, thanks to testing and treatment. Knowing your status and how the virus spreads are key to both prevention and early intervention.
So getting tested is the first and most important step if you think you might have been exposed or are at risk.
Definitely. Early diagnosis and treatment can prevent serious problems down the road. And even though we don't have a vaccine yet, taking those precautions we talked about can really lower your chances of getting infected.
That's reassuring to know.
It is.
Now, if anyone has more questions or concerns about hepatitis C, what should they do?
Talk to your doctor. They can give you personalized advice and help you figure out the best course of action.
And we also want to give you some resources where you can learn more. You can find great information on the CDC website, that's cdc.gov, and on the American Liver Foundation website, liverfoundation.org. We'll also link those on our website so you can easily find them.
And lastly, we want to leave you with a message of hope. Hepatitis C can be effectively managed and often completely cured, which means healthier lives for so many people. Take a moment to consider if you have any risk factors, and if you do, talk to your doctor about getting tested. It's a simple step that can make a world of difference.
Absolutely. Thanks for joining us for this deep dive into hepatitis C. We hope you found it helpful. Until next time, take care and stay healthy.